I'm sitting here with Dr. Paul Poirier. Hi, how are you?
Good, thank you.
Now, I want to know, what is your goal as a chiropractor, and how does that come into play with the CBP technique?
Well, CBP stands for Chiropractic Biophysics, and it's the most recognized technique that's come about in the last 20 years. There's maybe 50, give or take, techniques that are out there. The most common one used by most chiropractors is called diversified. It's been around for probably 60 years, and it's good, and it does things that I still apply parts of it, but its purpose is different than what our purpose is. Our purpose is not really to, how would I put it, to get rid of the pain for a patient. I think of a patient like a crooked car walking in or coming into my office, and my job is to straighten the frame because it got wrapped around a post. If the wheel is rubbing against the wheel well, that's a symptom. So I could rub grease along the wheel well and temporarily make it maybe rub better, rub less, but it's not going to solve the problem. Whereas if I actually straighten the frame, there's no more pressure on the wheel well, so that the actual turning of the wheel will be improved permanently. So my job is to really correct people's posture. Most chiropractors are more based on the old method of, you've got pain, okay, I'm going to give you an adjustment or two and you're out of pain. And then you might say to me, when do I come back, doc? And I could say, well, come back when it hurts again. Well, that's fine, but if your posture was that you had a straight neck, I didn't fix your neck in 2 visits. You might be out of pain after 2 visits, but the problem is still, the lingering symptom is maybe gone, but the problem itself has not been solved. So what we do is we position you in a position opposite of whatever your problem is. If your head's gone forward, then I basically put you in the opposite, like this, for so many minutes each time that you come in, so that over time your positioning might be back to like being like this instead of being like that.
Is the traction what makes patients feel better for the long term? Not just in terms of getting rid of pain, but actually fixing their problem physically?
No, the traction has nothing to do with making them feel better. Usually the adjustment, which is what we do on the other side of the office, is what actually relieves the symptoms, makes them feel better. But if they want to go beyond pain relief and fix their posture, this is the section of the office that we do that in.
Is it necessary that the adjustment process is done prior to the traction process?
Yes, it is. When you walk in and you haven't seen a chiropractor ever, or even if you're coming in at once or twice a week, whatever the pace is, if I haven't seen you for 24 to 48 hours, your body's somewhat stiff again. When I adjust you, I basically mobilized your joints, basically decompressed your joints. So what we're going to do for now is just try to decompress your spine a little bit, because we know you have a little bit of pressure that's built up. Taking a nice deep breath for me, and let it out. And again, and let it out. Excellent. Oh, I lost a couple of pounds. I'm down to 298. I'll have you onto your right shoulder. Taking a nice deep breath and let it out. Nice. And I'll have you onto your opposite side. Again, a nice deep breath and let it out. Beautiful. Okay. This is in order to reinduce normal curve, because she's lost a significant amount of her curve. So what this does is it reinduces the normal curve. Right now, she's in the mirror image of how she is normally. If a person's walking around like that, it won't get better on its own. Over years, it'll get worse, which causes you to get like this as you get older. What this does is actually making her head go like that for, in her case, 5 minutes with a 5-pound weight at this point towards getting the curve to go back. And then over time, she's going to be centered back to how she should be. And that's basically the goal of this particular one.